Since completing the course, our research team has implemented changes in terms of how we engage participants and families with lived experience of conditions. And I think the biggest thing we've done is all our research team now are expected to present to our patient advocacy group prior to submitting any grant application. We've had great feedback from both the researchers and from the patient advocacy group in terms of how this new initiative is working. And we are also developing a co-design research project, scoping the attitudes of patients around the potential translation of our research itself, which is, I think, very important part of this preclinical discovery-based research. It's not something that we consider enough in our work.
Since finishing the family engagement course, I've come to realise how important consumer involvement is in research. And through understanding this, I've been able to involve consumers within my own research and as well as help my colleagues to involve consumers within their research.
I have a deeper appreciation of the importance and value of doing research in partnership with families since I completed the training. I recently shared my learnings from the course with our research group and have begun to think about how I can involve families more in my PhD. For example, sharing the results and getting their input help inform subsequent phases of the project.
Since completing my training, I have been asked to be a consumer on two specific projects, two very different projects, but I feel so much more confident being involved in these research projects, knowing how I can best be a consumer, but also being able to somewhat educate the researchers in how important family engagement is. I've also sort of sat down with a few researchers and explained the importance of family engagement in research from the beginning, as many places and researchers involve a consumer about halfway through. And that isn't as effective as having a consumer from the beginning.